Hello, this is Luis. Welcome to the HDTV updates from ESC 2022. Today we bring you Day 2 updates of ESC 2022. Zanad presented the pooled analysis results of the liver and DAPA-HF trial, stating that advantages of dapagliflozin were evident in all patients independent of ejection fraction. SGLT2 inhibitors might be started in individuals with a clinical diagnosis of HF and no contradictions. Kausner conducted a session on new AF management techniques, discussing how pulsed field ablation is a revolutionary breakthrough approach for AF ablation. Pulsed field ablation will revolutionize catheter ablation by enabling quick, safe, and long-lasting PV isolation and OR, or duplication of the MACE technique. Hausletter reviewed the topic Transcatheter tricuspid valve repair, techniques and results, and indicated that a number of clinical and anatomic factors should be considered when choosing the ideal patient for tricuspid valve repair. Current registry data shows that in selected patients, favorable clinical results such as less symptoms and fewer HF hospitalizations can be attained. Sudano, in a session on whether gender matters in hypertension, emphasized that females with hypertension are more likely to develop atrial fibrillation and HFpEF, whereas men are more likely to have myocardial infarction or HFrEF. Females have a higher risk of stroke at lower blood pressure levels than males. CV risk increased at lower BP levels in females than in males. These results support the notion that gender does matter in hypertension. In an interesting session on TAVI Turn 20, a look back and a vision for the future, it was discussed that the indications for TAVI are expanding, such as asymptomatic severe AS and at-risk moderate AS. As per 2020 ACC/AHA guidelines, SAVR or TAVI is indicated for patients aged for age 65 to 80 years and TAVI for age more than 80 years. McMurray, in another session on how to treat a patient with heart failure and LVEF more than 40%, suggested that empagliflozin is the first drug to reduce CV death or first HFpEF in HFpEF patients. Moreover, the effect of empagliflozin on CV death and first HFpEF is consistent across multiple patient subgroups with HFpEF. Coates, in the session Beyond Echo and MRI, what other imaging is useful in HFpEF, stressed the importance of imaging in detecting, selecting, and monitoring patients with HFpEF, and that cardiac scintigraphy should be utilized in suitable clinical settings and according to recognized protocols. This concludes our coverage of the HDTV updates for Day 2 of the ESC 2022. We'll meet again tomorrow. Have a good day.